Okay, guys, so actually this is our lecture based on the information which provided by the aspirants who passed the exam or who were not passed the exam last year or even in the previous years. So according to them, at times, one of the questions in OSCE is about the rests and rest seats in the removable partial dentures. Well, let's see what are these rests and rest seats. First of all, see, this is the clasp assembly. And clasp assembly, it has, like, if we are not going into the detail of like different types of clasps, just we are talking about one circumferential clasp. So one is the retentive arm, the other one is the reciprocal arm, and this is the occlusal rest. Together, these three, they are joined with the help of minor connector with the rest of the denture. So this is how the clasp assembly it works. This is the rest. That's how the rest seat is made in molars and in premolars. And this is how it is made in the canines, in anterior teeth. What is the function of this occlusal rest when it is a part of the clasp assembly? It actually directs the forces along the long axis of the abutment tooth. So it provides actually support. And apart from that, it also does not let the denture impinge on the soft tissue. That is one of the major reasons we use it. If, like, say, for instance, in this case, the abutment is broken and still the patient is using the denture. So we can see that whatever the function of the rest, it is lost now in this way. And patient has this erythema because of impingement of the denture in this area. So again, the root canal treatment being done and the tooth has been restored with the recess in it for housing the rest over here. And now the denture is functional again. If there is no rest, so what is going to happen under the occlusal masticatory forces or occlusal forces, the denture it's going to slip and it will be impinging on the soft tissue. Well, when we are taking the impressions for the distal extension and the altered cast technique, these rests, they also help us in guiding where to place the denture with the impression material in it, or when we are doing the relining of the RPDs, they also guide us where we have to place the denture while taking the impression. So it is also one of the functions of these rests. Well, rests are also being used as indirect retainers, and in indirect retainers, what we see that which is the most suitable tooth, like the tooth which is very strong, and it should be at the 90° of the fulcrum line. Fulcrum line is that line, that imaginary line which passes through the two major abutments. So it should be at the 90° of that fulcrum line. Well, when you are preparing the rest seats, you should be applying very light pressure. Use always high-speed handpiece and must be using the water spray so that heat is not going to be generated. As we have to keep it in enamel, so depending upon the situation and depending upon the authorities, if they ask that you have to give local anesthesia in every single procedure, then you have to give the local anesthesia. If they say that, okay, you have to just keep it within the enamel, and it's not going to hurt that much, so there is no need for local anesthesia in that case. So it all depends upon the authorities, like the respected authorities, whichever you are going to do the procedure for them. Well, you can use a round head burr for that purpose, or you can use a cylindrical burr for that purpose. This is how we make it? It should be smooth flowing outline, no sharp line angles when you are constructing the rest seat area. And you have to keep yourself within the enamel. Don't cross the enamel, don't cross the this dentino-enamel junction, and don't enter the dentin. This is the way we make it. Now, another very important point is it should be having a shape of triangle with the apex towards the and near the center of the tooth, and the base will be towards the marginal ridge. Well, what should be the dimensions of the triangle? We divide the occlusal surface into 3 parts, and it is covering the 1/3 of the occlusal surface. Remember this thing. Always lower down the marginal ridge at least 1 to 1.5 millimeter in order to accommodate the thickness of the metal. The area where the occlusal rest, it is going to connect the minor connector. If you are not going to lower down the marginal ridge, what is going to happen? It is going to have a very thin metal in this area, and under the occlusal load, it is going to get fractured. So 1 to 1.5 millimeter, we lower down the marginal ridge in that area. And another very important point is as you go towards the center of the tooth, always it should be deeper in that area, your occlusal rest seat. It should be shallower as you come towards the marginal ridge, and it should be deeper towards the center of the tooth, so that the angle between the occlusal rest and the minor connector should be less than 90 degrees. Otherwise, it's not going to be retentive, and it's not, which we call it is not going to be positive occlusal rest. That's how it should be deep in this area. Deepest portion is the central portion. When you see it from the side, just in cross section, just to imagine, it should be having a spoon shape like this. And remember, very important point, at times they can ask you this question, that are you going to prepare the rest seat before the guiding plane or after the guiding plane? Guiding plane. So remember that we prepare it after the guiding plane. If you will be preparing it before the guiding plane, and then you are going to prepare the guiding plane over here, most of it is going to be ruined. Guiding plane is when you are going to make the teeth aligned or straight. Just giving you a brief idea because we don't have any questions or they don't ask you about the guiding plane. Guiding plane is that area where the rigid portion of the denture, it comes in contact with the tooth. At times you have to prepare to avoid the undercut. Just remember that this super area, it is called the suprabulgal area. This is the maximum bulgal area, and this is the infrabulgal area or the undercut area. So to avoid that undercut, we have to prepare the tooth with a straight burr. And well, we do it after the designing of the denture using the mechanical surveyor and all the necessary procedures we do for the designing of the denture, just giving you a brief idea. So at times they can ask you this question in terms of that, are you going to prepare the rest seat area before preparing the guiding plane or after preparing the guiding? We prepare guiding planes before preparing the occlusal surface. If you are going to prepare the occlusal rest after guiding plane, before guiding plane, then while you will be preparing the guiding plane, you will damage it. Just keep this thing in your mind. Occlusal rest seat form, it directs all the occlusal forces towards the long axis of the tooth. It should be designed in such a way that there must not be any off-axial or orthodontic forces. If there will be off-axial or orthodontic forces, the tooth is going to move in that direction. I told you that the central portion should be deep, and there is one way of checking it using the explorer. So you just put the explorer in the deepest portion, and without lifting it, you just start pulling it towards the marginal ridge. So if it is not going to be lifted away from the surface while you are pulling it out, it means your deepest portion was, like the central portion was deepest, and you have a positive rest seat, which will give us 90-degree angle between the occlusal rest and the minor connector. If you will prepare it like this, so while you are pulling it away, there will be gap between the tooth surface and the explorer, which is not going to give you the positive rest seat. So remember this thing as well. This is the conventional form of the occlusal rest. If you have to prepare the occlusal rest in a area where two teeth are adjacent, then you flare it a little more, the base of the triangle a little more towards the lingual side. Remember that. And if you are preparing two adjacent occlusal rests, then you will be flaring it both buccally as well as lingually, both the occlusal rests. They should be flared like this. We usually go for double embrasure rest or double embrasure rest seat form when we will be placing two clasps adjacent to each other in that case. This is the lingual rest seat on the canine. Usually we select a canine, but if canine is not coming at that right angle, in case of placing the indirect retainer, then we choose the central or lateral incisor in that case. Inverted V, and again, it should be the deepest portion should be towards the tooth. And as you come towards the lingual side surface or lingual side, it should be making it will be becoming less deeper, so that we are going to have positive rest seat. Remember that as well, like this. Use the explorer for that purpose to check if your rest seat is positive or not. This is the correct position. It should not be too low, it should not be too high. This is way too high. And this is way too low. You can use a round head burr for that purpose to prepare it, or you can use a cylindrical burr, no matter what. Cingulum rest seat placement. It is placed in the sound tooth structure or restoration. Do not place. Yes, at times the question is asked that if there is an amalgam restoration, are we going to place the rest seat over there or not? No, because amalgam is a brittle material. It is going to get fractured. And there is no any micromechanical bonding between the surface of the tooth and the amalgam. Yes, you can use it, you can make it, or you can prepare it if there is a composite filling or composite restoration. Do not let the occlusal rest come into the occlusion. Otherwise, due to hyperocclusion, patient is going to have immediately the periapical pain, and they will develop the apical periodontitis immediately. Well, at times what we do, we take another impression in the amalgam, in this alginate, and then we pour it in the soft plaster and occlude the upper and lower models to check if the proper clearance is achieved or not, if there are like multiple rest seat areas we have prepared. I told you about the bonded cingulum rest. You can provide where you can make it, especially if the canine or incisor, they have very flat surface, lingual surface, they don't have good cingulum, so you can make it. This is the correct way of adding the composite and make the rest seat area. This is over contoured. If it will be over contoured, it is going to accumulate a lot of plaque, which will be definitely leading towards the periodontal problem. And check out, there should not be any gap between the composite and the tooth. If that will be the case, it will be over contoured and a lot of food is going to be accumulated, and then it is going to create two problems. One is it may lead towards the caries as well as the periodontal problems. Well, at times a question could be asked for the anterior occlusal rest seats. Why don't we go for the incisal area seat? Why we have to make the lingual or on the singular? So there are various reasons. Lingual rest seats are preferred. They do not show metal when viewed from the facial area. Therefore, they are more aesthetic. They are placed more cervically on the tooth. So mechanically, they are not going to have any leverage, more leverage on it, on the tooth. And mandibular teeth, they are not coming into the occlusion. Otherwise, chances would be that there will be hyperocclusion and patient is going to have apical periodontitis like this. This is the incisal rest seat area, but we do not advocate it. Better to go for the lingual rest seat because it is not going to be visible. And secondly, it is not going to come in the occlusion. Third thing is it will be very close to the pivotal point or the center of resistance. So there won't be any leverage on the tooth. Otherwise, if the distance will be too long between the pivotal point or the center of resistance, then there will be leverage and it's going to be creating some deleterious effects on the teeth as well, on the abutment tooth. Well, you can also make the rest seat on the cingulum if the cingulum is really good, or if it is like you have to create from the lingual, from the like proximal area, you can enter this area instead of just coming directly. This is also one of the designs of the lingual rest seat form, like this. It could be easily incorporated in the crown. I have shown you one picture earlier that where the lingual rest seat area was incorporated into the crown as well. This is the incisal rest. As I told you, it is inferior mechanically and aesthetically, so we don't go for that. So over here, just I have tried to cover maximum things about the lingual rest seat and how to prepare it, and hopefully you would be able to follow these instructions, these points, and you will be also able to answer if any argument will come from the examiner. So inshallah, things are going to be helpful for you.